All right. Hello, everyone.
Well,
That's on me. Hi, Garia. All right. So, last week of class, we've gone over, my wife is doing okay. We both got our our antibody tests back, and both of us are negative for the antibodies, but that doesn't mean we're not infected. It just means that we don't have any sort of immunity to it yet. So we'll see how things go. It's, a little bit of an issue in New York that these tests take up to 7 days, which is like half the length of the virus. So I'm not quite positive. That's not great, but currently we're both doing okay. Yeah.
Peter, is this COVID-19?
Don't know. Could be. The COVID-19 symptoms are pretty broad. If you have something that's respiratory, it's probably best to assume you've got COVID.
Oh, okay. So you went for something else, right?
Well, we went and got tested, but you don't get to know the answer for the test for like a week in New York. So.
Okay. And this is something you just voluntarily go for testing, or you have some issues and you decide to go for a test?
You can go get tested for free right now in New York, no matter what. That's completely covered. So we just went to CityMD, a couple blocks from where we live, and she got tested because she was exhibiting symptoms, and I got tested because I've come in contact with people exhibiting symptoms. But I mean, they'll let anyone get tested. But given that it takes that time to get results, it's of limited use, since the entire course of the disease is supposed to be around 2 weeks. So having to wait a week, is not super helpful. But there you go.
Did they give any like procedures to do after? Because I got tested for COVID and they didn't say anything. Like, even if you have symptoms already, did they like tell you to stay away from people, or like you should be?
Given that my wife has symptoms, they told her to self-quarantine, but yeah, it wasn't an all hands on deck situation. It was like, you should probably stay home. Okay, see you later. And they didn't tell me
I thought that
anything.
was so weird when I got the test.
It's a little concerning. Like, I feel like I shouldn't be the one taking this the most seriously right now, but that's okay. Yeah. Kyria, come to New Jersey. It's 3 days, as fast as 1 if you are positive. That's nice. I mean, apparently CityMD is sending all of its labs out to New Jersey to get the tests done. So yeah, I don't know what the story is. It just seems like this is something we could have, as a city, gotten better at. But you're not here to listen to me talk about how testing is not great. We're here to talk about Chinese medicine. So we've covered everything that I thought was really central to this class. We're a week behind where I normally would have been at this stage, but we've covered all the important stuff. So we were going to do Shanghanlun and Wenbing. Goose Syndrome is really the only thing I want to cover that we haven't covered. I normally cover Shanghanlun and Wenbing towards the end here, but that's not that big of a deal. You're going to get those later in your education, and you're going to get a lot of it if you're in the herbal program. I just want to start introducing some other Chinese medicine paradigms that are still used that aren't really TCM at the same time, but kind of are. It's overlapping. So I was planning on spending some time over the past few days writing up a new 90 minutes on the difference between ministerial and imperial fire. I haven't had time to do any of that. And frankly, I've got to do some research before I'm ready to write that. So that's not something I can just do right off the chest, or right off the top of my head. So what we've got instead is I'm going to talk about Goose Syndrome for a little while, and then I'm going to ask you guys to pick between these 6 other topics, whatever you're the most interested in. None of it will be on the exam, including Goose Syndrome. We've already done everything that'll be on the final. And you guys can let me know what you're interested in the chat, and that can be what we talk about. I'm happy to answer any questions about what these things are. Shanghanlun would be covering cold disease theory, so infectious disease. So is Wenbing, also infectious disease. We can do some nutrition stuff. There have been so many questions about nutrition. We can do an intro to FCM3. We can just talk about pulse and tongue and a little bit about how to think about that. Yep, we can go a little bit deeper into root and branch diagnosis. I teach a weekend emergency medicine class. We can talk about that. So these are all things you're going to get, you should get at other points during your education as well. So, you know, we're just talking about an hour for this. So this will just be an introduction, regardless of which one. So yeah, if you guys want to just keep putting your preferences into the chat, I will, when we get to that, I'll look back and see what's, okay. I like that people are liking multiple ideas. Okay. Well, so we'll spend at least a minute on FCM3 then, and then maybe we can do the nutrition case study on juicing that I've got written up. That could be interesting. We'll check in again during the break. So let's start by, how are all of you doing? Everyone here okay? Anyone have any questions from what we've been covering so far before we dive into new stuff? I'm a little bit more discombobulated than normal, but I'm here and present now. If there are any questions, let me know. Am I going to be seeing any of you for Herbology 1 next semester?
Yes.
Ah, great. Great. That'll be a very different style of class in that it's much, there's more of a textbook orientation to it. I'm still going to be doing tons of talking. You're not going to be looking at a textbook on the screen. I'm not going to be reading out of a textbook, but there's actually a book that just has all the info, which is nice. Aisel, why does liver fire blazing occur? Do you want to ask that in a little bit more detail? There's lots of reasons it occurs. What is it about it that is confusing right now? Like, how do we get to liver fire blazing?
Yes, what makes liver fire blazing happen in the first?
Sure. So heat and fire are just on a spectrum. If you get enough heat, it starts turning into fire. That's the short answer. So anything that accumulates heat in the liver over time could turn into fire. Fire is just a worse version of the heat. So you get someone who's like kind of grumpy all the time and has a reddish face. That might just be heat in the liver. If they start having like rage outbursts, then that might be more liver fire. Alcohol can do it, that's for sure. We'd be looking more at hard alcohol than at things like beer, which are going to tend to create more damp heat. So things like heavy tequila drinking would be probably the fastest way to get to liver fire. I assume that's plum pit chi, not plea pit chi. So plum pit chi is the sensation of something stuck in your throat that you can't cough up or swallow. It feels like you've got something stuck in your throat. It's called plum pit chi, but the original text that talks about it says it feels like you have a hot piece of meat, like a little bit of steak, chicken or something stuck in your throat. They specifically call it hot in the original text, so it should feel hot and uncomfortable. And it tends to show up when people experience emotions. So you see this quite a bit you see this a lot in men who can't cry, but get angry instead. They usually won't notice this symptom because we tend not to be good at recognizing symptoms that we don't have words for. But if you ask about, like, do you get a feeling of something stuck in your throat? You'll get lots of people who look at you and call you a witch doctor, which is good. What does it mean that the gallbladder is the mansion of central essence? Yeah, so Danielle, good question. The gallbladder being the mansion of central essence gets treated in a couple of different ways. One of them is that the central essence is sometimes connected with bile. So the gallbladder stores the bile. It's considered a pure substance. It's considered mildly important or very important, and we can't do anything about it, so we don't talk that much about it. Little unclear on which. and the gallbladder holds it. So that's the standard answer that you're going to get. I'm not completely satisfied with that answer, but I don't have a much better one. The gallbladder has some connections to kidney essence, to Jing, but I frankly don't understand those aspects of it well enough to begin creating a new theory to take the place of the bile one. But bile is the short answer, but I'm unsatisfied with it. Any other questions? Okay, so let's talk a little bit about Goose Syndrome. I put the Heiner Fruehauf's interview about Goose Syndrome into the chat here. I'm not going to be reading off of it, but you should all read it on your own. I am going to pull out a couple of quotes from this and just drop them into the chat here. So that's one of them. These are basically these are kind of the highlights that they have in bold throughout the paper. Throughout the interview, it's not. So Heiner Fruehauf is chiefly an herbalist, and he runs a school and has classicalchinesemedicine.org as his website. Don't confuse that with Jeffrey Yuen's classical Chinese medicine. They're not connected, they're different. We have branding issues in Chinese medicine as a whole in the West. So there's a bit of confusion about what names mean what. So he's talking classical Chinese medicine. Most of the people who say classical Chinese medicine, what they mean is that they're starting from the Huangdi Neijing and other classical texts and working their way forward. So it's not intended to mean, as opposed to Jeffrey Yuen, whose classical Chinese medicine has a particular approach. I respect him. I think he's great, but a little bit different. So when Heiner's talking about Goose Syndrome, he's using this, he came up, what's the right way to say this? Heiner's a scholar, first and foremost, and then an herbalist and an educator. I don't really know how much he practices these days, but he was seeing a lot of patients who had disorders that he couldn't figure out how to think about within Chinese medicine. He talks, I'm not sure if it's in this paper or another one, in this set of interviews or another one, he talks about it a lot as looking like a Xiaoyong disorder, which is one of the Shanghunlin stages, where you get alternating fever and chills as a symptom. If you go back to the classics that write about the Xiaoyong stage, they say that anything that alternates with a wiry pulse can be treated as a Xiaoyong disorder. So any patient who has a disease that alternates and their pulse is wiry, you can give them the appropriate herbal formula for a Xiaoyong stage. Well, Heiner was doing this with some of his patients, and he wasn't getting good results, or he'd get results, they'd last a couple of weeks, and then the patient would go back to normal or get worse than they were when they first came in. So he was having this like one step forward and then one or two step back experience with a whole bunch of patients that he was treating for major issues in their lives, mostly chronic Lyme disease, chronic fatigue, fibromyalgia, this kind of cluster of syndromes that get a lot of cross diagnosis. Some irritable bowel sorts of things are in there, leaky gut, just this cluster of syndromes. And so being the scholar that he is, he decided to start scouring the classics in classical Mandarin, because he reads that, trying to find examples of this being talked about in history, right? Like that's one of the nice things about Chinese medicine is that oftentimes, so within Western medicine, if you are confronted with a case and you don't know what to do, you go to PubMed and other resources and you try to find someone who's written about this, and you're usually looking for someone who's written about it in the past 5 years. Within Chinese medicine, if you have a case or a type of thing that's showing up and you don't know how to deal with it, you start looking back through the past couple thousand years to figure out if there's a time period where this was a big thing and books were written on the subject. So that's what he did. And he found this thing called Goose Syndrome. So he didn't come up with this. He rediscovered it within the West, let's say. And to talk about Goose Syndrome, we got to start by looking at the character. So switch this camera over. If anyone here is into old Chinese martial arts movies, you might be familiar with some of the ideas in this. Some of these ideas still show up in Chinese fiction, but they have a background in history. So the character is pretty simple. He's got stylized versions of it. Excuse my terrible calligraphy. So this is the character, pretty straightforward. Let's break this apart. This character means poisonous insect. So that's supposed to be a picture of an insect with a stinger. Stinger, insect. And this character underneath is a pot which is used to cook down a substance. So this could be a soup pot, this could be an herb pot, it doesn't really matter. The idea is that you're cooking down all of these different poisonous insects together, poisonous animals, centipedes count, snakes count. And there was a period in time where one of the ways that poisons would get made would be that they would put all the poisonous insects, creatures they could find into a pot and basically let them all eat each other slowly. They leave them until there's one animal left, and then they extract poison out of that one creature. And then they use that to poison someone. And that's called goo poison. But so it's got this like kind of fanciful side to it, and this maybe assassination related side. But the theory about how the disease works is interesting. The concept underlying this is that outside of the fictional side of it, or the historically killing people side of it, is that these diseases would have almost a sort of intelligence to them. And that whatever it is you did to approach treating the disease would adapt to it. So for people who are nerdy in a different direction, it kind of functions like the Borg in Star Trek, where no matter what you're doing to damage them, they're going to adapt and get used to it. So you have to constantly be changing your method of attack. Heiner read about this. He read about some of the classical medicines that were used to treat this, and he developed, in his line of medicine called Classical Pearls, treatment protocols for treating Goose Syndrome. So one of the first signs that you have a patient that has Goose Syndrome is that it looks a little bit weird. And then as you go to treat it, your treatments begin to work. And then it's almost like the disease learns what you're doing and begins to be able to use your intervention as fuel. So his recommendation is to approach these things with alternating treatments. So things like 1 week, you're going to be draining and clearing heat and getting rid of phlegm. And then the next week, you're going to be tonifying the spleen and tonifying the lung. And then the next week, you're going to be warming cold that's in the person's body. And then the next week, you're going to be draining dampness out. So that every week, every time you're approaching their condition, you're creating a new stimulus that's still moving the person in the right direction. This is counter to how we normally do Chinese medicine. Normally, if there's like a 5-layer thing going on in the patient, we'll either treat that in one herbal formula where we're doing everything at the same time, or we'll kind of take care of all of one thing first before moving on to the next. So if a patient has liver fire with liver yin deficiency, we'll tend to take care of the liver fire first, and then come in and take care of the yin deficiency. We tend not to try to do those at the same time, or maybe like 80-20, get rid of the fire, nourish the yin deficiency. And in a Goose Syndrome presentation, it would be more like for 1 week we do fire, for the next week we do yin deficiency, for the next week we do digestion, and then we're back to fire and go in this looping system. So I have a question from Korea here. Is COVID like this? Doesn't look like it, because this is a chronic condition. This is not an infectious disease, usually. This is, what you're looking for is some sort of poisoning event in the person's life. most of the time. You may not always be able to find that. That's not necessarily mandatory, but Lyme disease would be the, yes, exactly, would be the biggest representation of it. And this is the area of our medicine where Goose syndrome is getting the most traction. So if you look within the Western medical framework, there's still a general consensus that chronic Lyme disease doesn't really exist. There's discussion of things like post-Lyme syndrome, but when people say chronic Lyme, what the Western medical establishment hears is that the person still has Lyme disease active in their body, and it appears more like after people get Lyme disease, other things go wrong, but it's not necessarily that that same virus is still active. So that is a perfect example of Goose syndrome. Something's gotten into the person's body, has an intelligence, it can't really be found and pinned down, and it's got to be pulled apart. So I'll got a couple of the private questions. I'll get to those in a second. If we go up in the chat a little bit to the first quote I put in, Heiner talks about it as goo is the oil that has gotten into the flour and now has virtually become one with the flour, and that's hard to get back out. He actually talks like this in day-to-day conversation too. It's this idea of like, normally we're trying to separate two things that don't really want to be together. So if you have fire in the person's body's working to get the fire out anyways. The idea with these Goose syndrome issues is that this disease has integrated enough into the person that we wouldn't expect to be able to find it easily. That's one of the features of the disease. So the fact that we can't find chronic Lyme disease as one thing that we can pin down is actually one of the things that we would expect to see with Goose syndrome. And that this process of pulling it apart should take time and be a little challenging. Yeah, so I've got a comment here about how different NSAIDs, your body can get used to various medications. So with a lot of medications that involve working with pathways that your body, now this is Western medicine stuff, with a lot of diseases that, with a lot of medications that mimic your body's natural pathways, as you increase the dosage of the medication you're giving, your body decreases the amount of the substance it makes naturally. So like, let's say your body thinks you should have a ton of stomach acid, and you don't really like having this much stomach acid because you get heartburn, so you take Tums. Your body still thinks you're supposed to have this high amount of stomach acid, so often it begins to produce more and more stomach acid, and you have to keep taking Tums more and more frequently. As a very basic example of this. The same thing's true for taking insulin a lot of the time with diabetics. Your body begins producing less of it. It's true with a lot of hormonal medications. And it can be true with things like painkillers. It's true of opiates. Your body becomes more sensitive in response to taking the opiates, and that's one of the things that makes the withdrawal difficult. In this case, this isn't that your body is adjusting to the herbal remedies or to the medications that are being used. The idea is that the pathogen itself is adapting. So one of the places we see this get discussed is with a lot of spirochetes, which Lyme is. These types of viruses that burrow into different tissues or hook on to places. Yeah, so next question here from someone who has chronic Lyme, fibromyalgia, IBS, and endometriosis. Yeah, so this is probably something to the person who asked that question. If you want to talk publicly, you're welcome to, but you certainly don't have to. Yeah, that's a good cluster of things. And I would definitely consider looking at Heiner's goo protocols for this. These things also show up in, not the chronic Lyme, rarely the IBS, not so much the endometriosis, but fibromyalgia and some IBS show up in later stages of Shanghong-Lun patterns. But yeah, for the chronic Lyme or post-Lyme syndrome, I would, the first thing I recommend is, for practitioners, is to look at Heiner Fruhoff stuff. And then after that, for patients, there's Hillary Frank. Give me just 1 second. There's a woman who I went to a lecture from her, a little Hillary Thing. I'd never met someone with the last name Thing before, but this woman has a basically Lyme only practice. She gave a talk at the Atlantic Symposium this past year. It's quite good. And she does an entire training program. So if people are interested in specializing in something like Lyme disease, she would be a good person to consider. Some autoimmune diseases, Crohn's especially, actually, the irritable bowel syndrome type autoimmune diseases can sometimes be Lyme disease. Can be Goose syndrome, but not Lyme disease. So that can be worth checking out as well. There's a lot of these things. Anytime you hear the word syndrome attached to the end of a diagnosis within Western medicine, you know that you're dealing with a diagnosis that's only partially understood. Often it's telling you that this is a cluster of things that we recognize happens together, and we see some aspects of a causal chain, but we don't understand the whole picture. That's usually what syndrome means. And even things like Crohn's disease are often, it's partially understood. So for a lot of those, we look at it. Crohn's can be a bunch of things. But yeah, so for a lot of the autoimmune diseases, for issues that seem to come and go and interact weirdly with what the person does. So this is, I start thinking of Goose syndrome when a patient comes in and they say, you know, I did an elimination diet, and as I was, you know, eating food again, I would sometimes feel good one day and then bad the next day, despite the fact that I hadn't changed my diet, and I seem to be really reactive to gluten, but only in the first week of every month, and the rest of the time when I eat gluten, I feel better. It's like you get these weird conflicting data points because this pathogen inside the person's body is consistently changing the data it's giving you back. So it's hard to get objective data about the person's condition. If you have a patient who has Crohn's disease and it has very clear and specific triggers, for me, we can usually work within that in a normal Chinese medicine framework. If the person's like, I can't for the life of me figure out what my triggers are because it seems like they change all the time, that's when I start looking at things like Goose syndrome. Okay. So there's a question here, is pregnancy a Goose syndrome? Obvious reasons that after birth, there are things that shuffle around like deficiency and excess in a way that's hard to track down. So no, pregnancy is not a Goose syndrome, but I see where you're going with that. Pregnancy involves a lot of rewriting of how extraordinary meridians work in a person's body. But more than anything, it damages the jing. What you're experiencing in the post-pregnancy area is damage to the jing, which takes a while to reset and rewire. Even things like postpartum depression is mostly just damage to the blood in the jing, which is actually really easy to treat in Chinese medicine. All right, another question. I feel like with Lyme, you're always trying to make the spirochetes happy. Yes. Okay. So, yeah. So that's the idea, is that a lot of the time these spirochetes, what are people's trigger foods are actually things that might be helping to clear this out of their system. So it's the questions of like, oh, when I eat strawberries, I get a flare up of these chronic Lyme symptoms. So I don't eat strawberries. From the practitioner standpoint, we might be asking ourselves, okay, is that because what the Goose syndrome is feeding on that, or because it's damaging it and we're then seeing a negative reaction from it? So when it comes to the actual treatment of this, it gets more complicated and well past, you know, first couple semesters of school. But I want to get this idea into your head that there are these other ways of approaching treatment where oftentimes, I mean, Hillary in her talk recently discussed stages you get to with treatment of Lyme, where you have to go slowly, because if you go too quickly, the person will get very sick as you're killing off a bunch of things. The parasitic die-off sorts of issues. So yeah, you're often balancing different approaches, and that's one of the reasons as well why you can't simply attack the disease and expect it to get better, because as you're attacking the person, almost like chemotherapy, you're hurting the person's actual physical body as well, and so you have to balance out, you know, removing pathogen, tonifying the person's body.
Can I ask a question, Peter?
Sure.
To that point, so in terms of treating Lyme disease, can you use to primarily rely on formula, or acupuncture is also part of the treatment?
When it comes to major medical internal disease, I think herbal medicine is usually very important. Acupuncture always helps as well. Now, they do different things. So you're going to get into conversations with acupuncturists as you go through school, where it's like, well, which one works better, acupuncture or herbology? And for me, that's kind of like, well, which is more important, diet or exercise? It's like, well, they're different. They do different things. So when we're dealing with systemic issues that are internal in a person's system, especially if they're in the organs or affecting the organs themselves, I find that having the herbal medicine in the person's system hyperpotentiate makes the acupuncture work better, and the acupuncture makes the herbs work better. They kind of go together. Oftentimes, if we're getting them past psycho-emotional blocks, if we're getting them past, if we're working with the internal reasons and struggles that they have around their disorder, I like acupuncture more. If we're trying to clear out a physical accumulation within their system, I like both working together. So like I've treated quite a bit of PCOS, polycystic ovarian syndrome, and I've had faster success getting rid of cysts on uteruses with acupuncture and herbs than with acupuncture alone, or herbs alone. But all three of those work. For this type of thing, I think you kind of, for this level of disorder, I don't know how to treat this long-term in a way where it completely goes away without herbs. I also don't know how to treat orthopedics without acupuncture. I mean, there's just different areas where each thing becomes more prominent. But I would still want to do acupuncture on this patient. Do you think Goose Syndrome affects Earth people more? So,
I guess I asked
maybe.
You mentioned in one of the prior classes that Earth people are like one thing one day, something like in a different, the next day they're like totally different. They're always accommodating. And so Goose Syndrome seems to me like it is accommodating with, like, it is accommodating that in that nature as well. Like, it's like,
Okay.
you know, on this, it's not like one or the other. It's just like, how do I feel today? And then that bug comes out that day.
I see where you're coming from. So on the psycho-emotional side of things, that sounds like a deficient Earth type person. In terms of this actual, in terms of Goose Syndrome, I would put this more in the sort of condition that wood people tend to get. I see this as more of a wood disorder, so it's more of a things growing too much. Which is also part of the reason it looks a little bit like a Xiaoyong condition.
Right.
This alternation is a big factor. So the person's like trying to fight off this Goose Syndrome, trying to make it better, and then the person gets symptoms while their body's fighting, and then it stops fighting, and then all of a sudden they're tired for a couple of weeks. So this might be like the person gets a really bad flare-up of Crohn's disease for a little while, and they're having really terrible bowel movements, and they're in a lot of pain, but they have a lot of energy. And then 4 days later, the Crohn's disease is gone, but also they're really depressed and they don't have any energy. So you get these weird alterations where often it's not like sometimes it's good and then sometimes it's bad, which would be the standard Xiaoyong presentation. It's more like sometimes it's bad in one way and good in one way, and then sometimes it's bad in another way and good in another way. So that when you say like, oh, are things better today or worse? They're like, yes. Some of them are better, some of them are worse, and some of them are new. And next week it's going to be the same story. So as you attempt to gather data about it, it becomes almost impossible. And often these people end up getting referred purely to psychological consults within Western medicine because the attempts to gather data fail. So the idea is that, well, this must be in the patient's head. And thankfully, we in Chinese medicine just don't have the concept of things being in a person's head. So when the patient comes in and they're like, I understand that I'm presenting you with pure chaos for the 10th week in a row, we as practitioners go, okay, well, what do we do when we're presented with pure chaos in an ongoing way. So within the TCM model, we would treat for phlegm, right? Strange diseases, things that don't make sense, you treat for phlegm. And this is just taking that thought process far further. Treatment of Goose syndrome started by treating it like phlegm, and then realizing more and more that this was a complicated and specific thing. That makes some sense?
Yeah, so if you're both wood and earth, you're kind of screwed.
That's a rough combo to be. Yeah, I mean,
Yeah.
so wood, like wood in a healthy way is about being an individual, about doing what your purpose is here to do, about growing outwards. On the negative side, wood is things like cancer as well, right? Growing too much and growing inappropriately. And then earth is largely about wanting to create a comfortable space for other people and for yourself. So the like pull in one direction to be an individual and the pull in the, in the other direction to take care of people, those two often come into conflict, which is one of the reasons we have so much wood overacting on earth as an issue. And we're in a society that really heavily values the wood phase, the individual side of things. I'm not saying that's a good or a bad thing. It's just our value system, mostly wood and fire. I mean, you guys are like, we as a society really don't like metal. Like you guys will hear people talk about like, oh, metal people are jerks. Well, maybe that's a sign that we might need more of them. Yeah, but yeah, wood and earth is a rough combo sometimes. Veronica mentions that acupuncture will help the symptoms of die off from the herbs. Totally, 100%. It can also help to direct the herbs a little bit. So, you know, if you're treating someone who's got like a lot of heart fire and you're treating it through herbs and you're going to get it out through the urine, doing acupuncture to make sure that that pathway is open so that when the person gets that heat out through the urine, they don't also get a urinary tract infection or don't have other side effects and symptoms. Like you can almost, like if you think of the herbs as like delivering a package to the person, the acupuncture can make sure that the pathway that it takes to get there is easy. Like make sure that the shipping is on time and that, you know, the package doesn't get damaged. Even with herbs, we don't want to dose higher than we have to dose. So very often with herbs, we can lower the dose of the herbs by using acupuncture at the same time, or we can take herbs out of the equation if we're also doing acupuncture. So I found myself in a number of situations writing an herbal formula and then taking a few herbs out and going like, oh, we'll just take care of this with the needles. Sometimes you get patients coming in and one of the symptoms of their yin deficiency might be that they can't sleep. It's like, okay, so are we gonna add heavy herbs that might be a little bit depressive that help them sleep? Or do we just treat the sleep side with acupuncture and then nourish the yin deficiency? And then we can have more herbs for the sleep, for the yin deficiency and make a bigger dent in that because we don't have to treat the branch of the sleep. Yeah. Okay. So I don't really want to go that far into the actual treatment of Goose syndrome because that's not it's not going to mean a lot to you guys at this stage because it involves complicated herbal treatments because again, Heiner's seems to mostly be an herbalist, scholar, herbalist, educator. So suffice it to say, it involves altering between different approaches at regular intervals. So it's kind of I find it interesting because it's one of the few areas of Chinese medicine where how the patient's responding is not super important. You can often lay out like 6 weeks of treatment and barring like a really dramatic and unexpected result from your patient, you can send them all 6 weeks of those herbs and just really take these, call me in 6 weeks unless something goes wrong, which is kind of convenient and has created a lot of pretty successful chronic Lyme practices because these are protocols you can implement pretty smoothly. You guys should remember the herb Futza, Aconita radix lateralis preparata from Intro to Herbs. So that's one of the main herbs that Heiner Fruhoff uses. And what do you guys remember about that herb from Intro to Herbs? I'm curious what they're teaching these days. Feel free to just speak up.
It's somewhat toxic, right? And
yep, mildly toxic.
Yeah.
And hot, yep. Any just general impressions? Is this like a commonly used herb? Is this a herb you don't really use? Is it, I mean, it's mildly toxic, so it's a little dangerous. Do you guys remember small dose, medium dose, high dose? Do you remember?
I just remember it being associated with kind of reviving young, basically.
Yeah.
Okay.
Yeah. So, okay. So, 止腹子, meaning prepared 腹子, is used for the treatment of yang deficiency mostly, or people who have a lot of internal cold. And it's usually used, I believe, at 1.5 to 4.5 grams. I think that's what Bensky has listed. Heiner starts around 20 grams and goes up from there. So he's part of the Huoshenpai, the fire sage school of herbology. And their two main herbs are Fuzi and Rogui, aconite and cinnamon bark. And so those are both very heavily used. Yeah, Acel's got it. So within their perspective, Fuzi and Rogui are the two king herbs. Other schools of thought have different things that they focus on. But the basic idea is that if the person has sufficient yang, they can kind of deal with anything. It's not completely true, but there are places where what they do works really well. And so he's got a lot of both of those herbs in his treatment of Lyme disease. When you think cinnamon bark, the stuff that we have at the school is not very high quality. The high quality cinnamon bark is very expensive, and it comes in a slab like this with purple veins running throughout it. And the smell and flavor are 10 times anything I had encountered that was called cinnamon before that. So it's kind of a different plant. Yeah. So that's the basics of Goose syndrome. Just something to keep in the back of your head. Plenty of the practitioners in the clinic aren't really going to know about Goose syndrome, but there's also no reason why everyone should know about this. This is kind of a specialist thing. It's just an area that is particularly underserved by Western medicine that we're slowly getting pretty decent at treating. So there's a lot of opportunity. It's also a set of conditions that seem to be getting more and more common within the US. So my general advocacy is we should get good at the things that Western medicine is bad at. And this would be an example of that. So if this is something that any of you are dealing with, this is also an area that you can have a very successful practice treating, because there are a lot of people here who are in need of a lot of help and don't have a lot of options. And we are now at the point where you can do like a multi-year graduate study, postgraduate study in how to deal with these sorts of things. So yeah, just wanted to introduce you guys to that. Let's take a 10-minute break, just 10. We'll be back at 2:17, and we will go into, well, I'm going to look through your responses. Well, FCM3 introduction and some nutrition, I think. And if anyone has questions for the next 10 minutes, I'm here. Thank you. Okay, I'm getting multiple private questions from people at the same time here. So if any of you want this addressed publicly, I can do that faster by talking than by typing. So for the person whose father had some, who had Crohn's disease and then had their colon removed. Yeah, so I mentioned in an earlier class that if a person doesn't have enough stomach qi, acupuncture doesn't really work. If a person doesn't have enough qi, just in general, acupuncture doesn't work very well. We can use it to tonify their qi. I've yet to have a patient who's under 80 for whom this was an issue for more than a week or two. Usually you just start building them up and that takes care of itself. So if a patient doesn't have enough qi, I tend to like 3 needles in each stomach 36 with heavy stimulation. And then I tell them to eat all the food that they can over the next week, and then we'll address it the next time. There are exceptions to that, but that's kind of how you start. Once it gets to the point that a person's had major surgery, the stories start to change a bit. I don't have any problem with surgery as long as there's no acute reason to get it. I generally tell patients, let's try everything that isn't surgery first. And then once all that's been tried, then I would totally be in favor of the person getting surgery. So in this particular case, I would want to see him because I don't know is the answer. Also, there are a lot of bad acupuncturists out there, just like there are a lot of bad every profession. You know, we've got standards in place to try to prevent bad acupuncturists from existing. You know, we've got board exams, we've got, you know, fairly rigorous school at this point, but there are plenty of people who went to acupuncture school in the late 90s who did 9 months and never took a board exam and got grandfathered in. Some of them are great, it turns out. Some of them probably shouldn't be handling needles. So, you know, we, just like every profession, you know, you're all gonna get this semi-regularly. I get it semi-regularly. Oh, I tried acupuncture for XYZ and it didn't work. Like, that doesn't really mean anything to me. Like, who did it? How many people have they treated? Do they have a specialty? Because if you went to an orthopedist for, you know, menopausal issues, then I wouldn't be surprised if they did a bad job, because that's not what they do. So yeah, that would be the answer that I have now.
Thank you.
Yeah, for sure. So Lindsay asked, in case we don't get to talk about emergency medicine today, is there a point in the program where we go over that? Do you know? There sure should be. I don't know if you do. I learned my Chinese medicine, emergency medicine before I went to acupuncture school. I started off doing Tui Na. And then went over some of it in other places and other classes. There are people who teach this material. The best place to start, which is, I recommended this back in like the 4th week, is the book, The Tooth from the Tiger's Mouth. That's an introductory book. It's laymen can read it, students can read it. The Zhenggu Tui Na people put it out, Tom Bizio put it out. They have more that comes after that. They teach classes here in New York. If you want to learn some real good massage and how to do Chinese bone setting and also a bunch of emergency medicine, they're the people to go to. They're one of the people to go, one of the groups to go to. Yeah, but Chinese medicine, emergency medicine's really cool. So I would recommend learning it. I'll be teaching some of it. I'll be teaching some of it in Herbs 1, I think. I think we get to those herbs. Yeah, there's a lot of great Chinese emergency herbal medicine. I have a travel kit that under my desk. This bag is about 80% full right now, but at 100% full, that's 3 months of treating 30 people a day for everything. And you'll run out of some herbs at some point during that, but as someone who's practiced in a bunch of other countries, it's you just make a bag. And before traveling yourself, like you got your toiletries bag, and then you've got your all the herbal stuff bag. Okay. Just reading another question here. Okay, so there's a person talking about using a machine that measures bioenergy and using it for scans that then tell this person what they need to do, like clear heat or clear heat in the blood. And then it recommends golden flower herb formulas. Some people really like those machines. I don't like them. They're really new in terms of Chinese medicine. If they're still around, if they gain prevalence, if they get used more over the next 20 years, then I'll probably begin to get interested in them. But right now, I don't know if a practitioner comes up to me and the practitioner's seen 10,000 patients and they say, I took this patient's pulse and looked at their tongue and I diagnosed them with this condition. I'm only mildly skeptical of what they have to say, but when a machine reports back that based on some bioenergetic criteria, they've come up with a certain diagnosis, I just often disagree with the criteria they use. So things like, you guys have probably played, you may or may not have played with pointer excels. These things, I don't know if you've encountered them in your acupuncture, like hands-on classes yet, but it's got this little light here at the top. And as you put it on different parts of your body, it tells you how conductive things are at the skin. So like mildly, and then as we get to large intestine 4, it goes up, and then it goes down. Got to set that sensitivity right. Yeah, so if I'm like right up here on the knuckle, there's nothing. And then there's large intestine 4. It does things. It tells me how conductive the skin is at the surface, but I don't know what that tells me about the underlying condition. So a lot of people take this and then go, oh, it's not conductive here, so you have a blockage, so we should put a needle there. I just don't think that that's what a blockage there means. Like, so, you know, we've talked a lot about how different things connect to each other in Chinese medicine. So if a person comes in and it's like, oh, you've got blockages all over your large intestine channel, for me, it's like, yeah, but why do you have them? Yes, we probably should get rid of those blockages, but do we need to, are they there because you're qi deficient, in which case moving qi is the wrong answer? That device is a Pointer Excel 2. I can show you guys a quick trick with it since we're on a break. It's 217, kind of off the break. So it both senses things on the skin, but it also sends electricity through needles. So if I take a needle, this is obviously not standard TCM because we're using, you know, electricity, or it's not classical, let's say. So needle in my arm. See how my hand's twitching? Zero control over that. That's using the Pointer Excel to override nervous control of the body in various areas. Use it for orthopedics. Useful tool. No real point in getting it until you get maybe through like advanced acupuncture techniques classes, but yeah, they're good. I was in talks with the school to do an orthopedics class in January of this past year, and then I broke my leg in 3 places, so it was a moot point. But when I was in talks to do that, I was talking with Cam Wo about finding a way to buy these in bulk, because that was going to be a required part of the class. They're a good tool. I've been using this one for, probably 4,000 patients at this point. Hasn't broken, barely ever even have to change the battery. Very happy with it. Okay. Any questions before we get back into things? That was most of those questions were private. So if the chat looks empty and it looks like I'm just ranting on my own about this, there are private chats related to that. Long and short though, in general, I'm not the biggest fan of machines that do stuff, with a couple exceptions.
So that little gadget, Peter, is that it's electric? It sends pulses?
Yep. Completely adjustable. You can change the frequency. You can change the type of wave you're putting through. It's got metal panels on the side, so you hold it and you make a complete circuit. and then it sends it through the needle.
But you can't leave that on the needle though, right? I mean, I've
No.
seen, no, so you just, it's a momentary kind of manipulation you use for a bit.
I use that to test to make sure I'm in the right point, and then I hook up an Ito 310
With
to do
this
the longer term.
little, yeah,
Yeah.
okay.
These,
Very good.
sorry, Ito 130. These are great. They're more expensive. It's just nice because it's so small. You guys, I think you have the Pantheons in the clinic these days, like those big boxes to do e-stim. This does all of that and more, but it's small enough that I can put it on the table and you don't have to plug it in.
So is this technique ever seriously incorporated in one of the point classes or clinic class?
I got taught this by taking classes outside the school while I was a student. If I ever teach a needle technique class, I will teach this. It used to get taught in orthopedics classes, but I don't think the school really has orthopedics classes anymore. So I don't know these days if that gets taught and when. I do know that there are, I think Jeremy Pulsifer used to teach it in a points class as well. Yeah, I just don't know these days when and if that gets taught. I learned it outside of school. But I will certainly teach people who are on clinic shifts with me if we get relevant patients.
That point Excel2, it also work to manipulate the points or just with the needle? Oh, okay.
Yeah, I mean, you can use it directly through the skin. It's just a little bit unpleasant. So like I use this to release the levator scapula myself fairly regularly because the motor point's really close to the skin. I mean, you can't really see it. See how my arm and shoulder are moving? That's the pointer Excel. I can't control that. So yeah, useful tool. Yeah, Danielle, I'm a big fan of Camwo. They do deals pretty regularly. Tom's a great guy. Can't say enough about them. I picked up herbs from them yesterday. They're good. That's the herbs shop I went to when my wife started coughing and we thought she might have COVID. They're good. Okay, so let's talk a little bit about FCM3. Give you guys some real basics here. It was really nice back when I had that whiteboard desk at the beginning of the semester. Like, hopefully that'll be something that exists again in the near future. But for now, we're just going to be going with this. So FCM3 covers a lot of different things, but what I want to talk to you guys a little bit about is how to diagnose, like what tongue and pulse stuff, how to think about them. So COVID shows up differently in different people. The main thing I'm concerned about, my wife, Emily, had asthma when she was younger. And so the main thing I'm concerned about for her is damage to the lung and phlegm accumulation. So I chose Guoshang Zhengqisan for her, which is a formula for sudden turmoil. It's used for things like food sickness semi-regularly, but it really dries out the digestive system and stops the production of phlegm and helps to just decongest everything. Yeah. So that's what I'm currently taking and she's currently taking. I'm also, it's better not to treat your partner. So we're going with a simple herbal treatment. And if things get at all worse, then I'll be referring her out to somebody else. I tend to treat her for aches and pains and some basic stuff. But it's kind of hard during these days because things are half open and it's all weird. Okay, so FCM3. So there's two things I kind of want to talk about here. You guys let me know if there are other things you want to hear about. Pulse diagnosis and tongue diagnosis. We're going to be stopping at 3:05 on the button, so you guys can take 10 minutes and then do the quiz. The quiz will be open on the Moodle, 3:15 to 3:30. Okay, so these are the two things I want to talk about. What do you guys know about pulse diagnosis and tongue diagnosis? Like, we use these things to gather information about patients. What else do you know? Can you guys tell me all the pulse positions?
Sun Guan Qi.
肾关
Yes.
节
Sun Guan Shi. So that means, let's just do this. So, right hand, left hand. We usually write this backwards because what we're talking about is the
Yeah.
patient, right? So this would be the patient's right hand and left hand coming towards you that you're looking at. And then we generally write this as
heart
Sun Guan Shi, which is also distal and proximal. So that means that our first pulse position, the Sun position, is the one closest to the thumb, then in between, then closest to us. So do you guys know the pulse positions for the right hand?
lung
Spleen.
Yeah.
Kidney.
stomach kidney
Good. And the left?
heart
Liver.
liver
Kidney.
kidney
So there's debate about what some of these are. There's also much more complicated versions, but this is honestly enough for the majority of pulse diagnosis. You're learning a lot of things from this. So we're basically looking at upper jiao, middle jiao, even though the liver's technically in the lower jiao, and the lower jiao. So if both of these have a really strong characteristic, what we might be seeing is just that the person's abdomen is doing that, or like right around their xiphoid process. Both of these have the same characteristic. We might just be talking about the person's chest in general, in addition to these organs. The way this is usually taught is that this is both lung and large intestine, and this is spleen and stomach. This one I think is true because they're basically the same thing. This is heart, and I guess this is usually taught as small intestine, and liver and gallbladder. And I think that's just completely unnecessary to think about when you're first learning it. So we're not really going to talk about that today, but that's how it's usually discussed. When you're looking at the pulse, so these are the positions. This is where they are on the hands. When you're thinking about the pulse, let's call this the blood vessel that's going through the person. And these are terribly drawn fingers. Hopefully you cut your nails better than this. Your finger comes down. Person's pulse is coming through here. And the question is, what is it that you're actually looking to feel in this space that you're going through? So we have a bunch of different variables that we're working with. One is we want to know the depth. Where is the pulse? So it gets talked about as touching the point, the pulse positions with the weight of 3 grains of rice. Can you feel the pulse? If so, that would be called superficial or floating. But you can push all the way down to the bone. You can get to the point where you occlude the pulse, where you're pushing hard enough that the pulse can't go under your finger. So that's deep. That's as deep as we go. So depth can be anywhere between, superficial to deep, depending on how far you have to press down. Now, I would recommend not trying to apply any of this right now. You'll get you should have tons of time to do that next semester. But there are different, as you feel, it's like, well, superficially I can feel something. And if I go deep, I feel something. And then there's a bunch of stuff in the middle. What the different depths are get calibrated as you do this a ton. But the first thing you want to figure out is, does light pressure or strong pressure get me a stronger pulse? Looking at depth, looking at rate, how fast. That one's pretty straightforward. Classically, this is measured in terms of how many pulses there are per breath the person takes. But in modern times, we're usually basing it on a per minute scale. This is usually taking the pulse for 15 seconds and then multiplying it by 4. Some serious pulse people say not only is 15 seconds incorrect, but really you need to take the pulse for 2 minutes before you can determine anything like this, because pulses change and you need to track the changes. And it's like, well, sure, if you think you're going to get more information out of it, but if tracking the pulse changes your estimate from 65 beats per minute to 67, like, how much do you care? How much of a difference is that for you? It's important to have the sensitivity to pick up minute differences in the pulse, but at the same time, differences that take a lot of effort and don't get us any new information or are not any useful information isn't very helpful.
Peter,
yeah.
can you quickly go over where the position actually is located on a hand for like Qin Guan Zi? Because every, like, I see different people taking it different places.
Yeah.
Feeling the pulse. Thank you so much.
Christy, can you go into more depth why those locations correlate with the different organs? So, yeah, so I can answer both your questions at the same time. So, if we're looking at the wrist, let's see. It's so weird to figure out how to show you guys things over this without it being really awkward. Okay, so if we're looking at a wrist, that's my wrist. Hi, everyone. There are a couple of anatomical landmarks we want to work with. You've got this little bony prominence right on top here. You can feel basically the
That's your
distal head of the radius. What you tend to do is put that in between your index and middle finger and slide down. So on me, this is so awkward to show the camera. So for me, this is very awkward to show the camera. All right. So when I'm working with myself, it's easy. Bony prominence right here, come to the side, slide down. If you can feel that tendon that's underneath, you've gone too far. Right here, there's a tendon. Right here, there's a bony prominence, which means that these pulse positions are basically going to be here, here, and here on me. Those should be equally distal, but that's about the information. So as I come down to feel that, my fingers land right there. My hand's backwards because I can't show it to you any other way. Those are the pulse positions. Different people are going to tell you slightly different things. The pulse position is also based on your patient's wrist size, not your wrist size. So if I'm treating a child, for example, if I'm treating a baby, I can really only take one pulse position because my one
For babies,
finger,
don't do like the middle finger? For babies pulse, no.
There's a number of other things you can also do with babies. You look at like the vein on their finger and a bunch of other stuff. But if you're actually trying to take their pulse, your finger covers all three of their pulse positions. If I was working with someone who's 7 feet tall, I might be taking their pulse like this because it depends on their body where their pulse is. On me, on yourself, you generally take the pulse like this. Right? You're feeling fairly lightly. You're feeling with about that part of the finger here. So not exactly the tip, not fully the pad, but kind of right in between. Like right about here is usually where you're feeling. This is so weird to do everything. And you're feeling, this is just like the tongue, just like the ears, just like the feet, just like the palms. This is a mirroring system. The system is telling us about what's going on in the inside of the body. When the person sticks out their tongue, it's a mirror. When we look at the ears, it's a mirror. The pulse is upper, middle, lower. That's what we're getting told. Upper body, middle body, lower body. So Christy, to your question about the locations and the correlation with different organs, it's mostly about where in the body it is. And then the right hand is mostly about chi, and the left hand is mostly about blood, which means that the right hand is more about what's happening right now, and the left hand's more about what's happening over time. Lung, spleen, postnatal chi production, heart, liver, all the blood-related things, right? That make sense?
Yes. And is there a reason, like, at least for me, for pulses wise, like the Ci position usually for the kidneys, is it usually weaker than the other pulses?
It's
In
usually,
general?
whether or not it's weaker is important to know, but what's more important is how deep it is. So as you take these pulses, we're not going to go too much into like what pathology looks like, because we just got to start off with what even are pulses though. So we're looking at depth and rate. Usually it should be that this is the most superficial and this is the deepest. But before we even get into that, really, we got to look at this and ask, what is the pulse telling us? Why does the pulse change? And the pulse is telling us, where is the chi? And what is it doing? Right? This is what the pulse tells us. So for example, if a patient comes in and they've got a slow pulse, what emotion slows the chi?
Depression?
Try again.
Joy.
Joy. Excessive joy slows the chi. So if we encounter a slow pulse, we either know that the person has something wrong with the fire, usually the heart, or that they've got cold inside their body that's slowing the chi down. That's another way it can happen. So slow pulse tells us this right off the bat. You see this with a lot of marathon runners, where on the one hand, they've got a very healthy heart. On the other hand, they don't really have emotions anymore. And as you start investigating what goes on in their emotional life, there's not a lot of availability for communication. For my TV watching students out there, this would be the character Chris Traeger from Parks and Recreation, who's very happy, everything's great, works out like crazy, and if he stops, he falls apart. So depth, rate, and then we've got a whole bunch of other qualities. But honestly, I mean, I really think the first 100 pulses or so should really just be focused on feeling depth. And then we've got qualities. And this is where we see all of the words that tend to get used in clinic. This is where slippery is, this is where wiry is. And a lot of these are going to be dependent on, this is all qualities. We've got width. So as you press down into the pulse, as you're pressing down into this pulse, is the pulse narrow or is the pulse wide under your fingers? That's an easy characteristic. Things like thready, wiry. These are telling you about the width of the pulse under your finger. Telling you about the width of the pulse under your finger, but it doesn't tell you anything about the depth. So wiry or a thready pulse means that when you touch the pulse with your finger, it feels like there's a wire underneath it. But if you press harder, it might be wiry all the way from the surface to the deepest level. That's going to be a lot different than a pulse that's wiry, but also only in a very tiny area. These ideas making sense to you guys? Kind of.
Yes, thank you.
Oh, thank you. I appreciate that feedback. I got a lot of people with their cameras off today, so it's a little bit hard for me to see what's going on with a lot of you. So as we're going through these different pulses, you basically want to think, what are all the different ways in which this tube can be formed, this blood vessel can be formed? How are all the different ways that you could feel that with your finger? And that turns into all the different things. So if it's narrow, and then we've got a whole set of words that relate to that. Wiry, thin, thready, taut, bowstring. We have all these different words that indicate that it's narrower. So what's the difference between something like thin and wiry? We also want to ask, with, we've got tension. How much give is there in the pulse? How much resistance is there? So, for example, when I push down on the pulse, do I get back something that hits my finger and makes my finger want to move? Or is the response something more like it flexes around my finger? These are both things you experience with the pulse. Does it push or does it mold around the finger? And those are about how tense the actual vessel is. So you can have something that's big and that pushes back against the finger. You can have something that's big that kind of goes around the finger. That's usually what we mean when we say slippery, is that it goes around the finger. Or you can have something that's very thin and pushes very hard against your finger, or very thin and goes around the finger. So we have all these different words. So the difference between wiry and thin is usually that wiry feels like a wire. As you're pressing on it, it pushes back against you because it has this tension to it. If it's thin, it might push back a little bit, but it's not particularly notable. You can resist it. So we have all these different characteristics that go into feeling what's going on in the pulse. And then the terms that we use. So very often when this is taught, we go right into terms. Like, all right, this is a rapid pulse. This is a slippery pulse. But those are amalgams of these other things. If you read Li Zhen's actual book, which it appears most people don't do, he talks about this. He says slippery is a combination of these other qualities. Wiry is a combination of these other qualities. Some of the ways that we talk about pulses don't really make sense. Like a slippery, wiry pulse, after you've felt 10,000 pulses, you can be like, okay, I can get what you're saying when I feel this. But for a beginner, those pulses actually are contradictory. Those can't exist at the same time. It might be that it's slippery, but there's a hint of a wiry quality, but that's not helpful for beginners. So you often want to start off with like, okay, is it deep? Is it fast or slow? Is this a broad or a thin pulse? And how tense is it? And then as you get better and better, which, you know, you should be able to do this by the time you're towards the end of being an intern, not only should you be able to tell these things, but you should be able to guess what you would expect to see from the patient. And then you should be able to see how much that deviates. So if I'm seeing a very thin, slight, pale, soft-voiced patient, I would expect their pulse to be somewhat thin. If their pulse is normal, then that might be a wider pulse. That might indicate something odd for them. I don't think the slippery pulse has much to say about tension. It tends to go around the fingers. So the traditional description of a slippery pulse is that it feels like pearls rolling on a plate, which is not helpful at all. So when you see a slippery pulse, what I tend to feel is, I mean, slippery is one of our most commonly used pulses, but that doesn't mean it should be. I've got a couple of private messages. I'll get to those private messages in just a second. This might just be doing pulse today. So when you get a slippery pulse, this is mostly my experience. This is less Li Zhen, but I'm trying to talk to you in the language of what you actually feel as opposed to pearls rolling on a plate. There will be plenty of time for that. So this is our vessel, and our patient has a slippery pulse. So one of the questions is, how does the pulse roll through this pathway? So you've got all three of your fingers down, wonderful anatomically correct fingers. And sometimes a pulse feels like it rolls through like a wave in the ocean. It's like hits this finger, hits this finger, hits this finger, and rolls out. Sometimes you get different qualities on each finger as it comes through. A slippery pulse tends to hit all three at the same time and tends to bend around the fingers. That's the best way I can describe it. Sometimes it'll have a little bit of a rhythm to it. It tends to be fairly simultaneous. It tends to fit around the fingers. And you tend to be able to feel it at a fairly superficial position. But of course, that begs a whole bunch of questions. I mean, this is, yeah, and that means I've never kept my pearls on a plate. That's not where I tend to keep them. So when you're, we shouldn't go there, that just adds complexity. So when you're talking about a slippery pulse, you're talking about a specific depth, which is superficial, but also all the way down. Superficial and deep. But if you only feel it at a deep level, it's kind of something else. Slippery pulses are usually slightly rapid, and they're usually low in tension. Well, as you go further along, you want to figure, so in general, there's, okay, so I'm going to start talking about pulse qualities here, because that's enough of an introduction. That shouldn't answer all your questions, but again, you're going to spend weeks on this. So the question from Allison is, can a slippery apply to just one pulse, or is it all three? So the first thing you want to figure out is be able to tell overall pulse. And the easiest place to start there is speed, and then excess or deficient. So patient comes in, do we need to tonify or do we need to drain? You should be able to tell that after 20 pulses with decent accuracy, whether or not it's an excess or a deficient pulse. That's pretty straightforward. And you'd feel this by putting all 6 fingers on the patient and feeling the overall quality, feeling what's the same about everything. But over time, you are going to split this into 6 pulses, right? 3 positions each hand. And then that can go down a rabbit hole. If you want to go further, I believe the Shen-Hammer pulse diagnosis system, I think has, was it 82 pulse positions? This is 6. They have a ton more. So they start doing things. You're not going to learn this in school. You sure don't have to learn this in school either. But they start doing things where they take a finger and they roll it down to feel positions in between. They come up onto the hand to feel extensions of the pulse. Don't worry about that. Yeah, that's the basic story. The first thing you want to make sure you can do is figure out the overall pulse. And oftentimes, as you're doing this, you get into these arguments between students of one's like, it's slippery. And the other says, it's wiry. And you want to figure out what is it we're actually disagreeing about. Because as a beginner, slippery and wiry don't really mean anything. So what you want to start figuring out is, do we agree on the depth? Because we should agree on the depth first. Can we agree on whether it's fast, slow, or normal? And then can we agree about how wide it is? So like a flooding pulse versus a slippery pulse is largely that tension and width. Should be about the same depth, should be about the same rate, but the flooding pulse should be bigger under your finger and the tension should be stronger. So if I say slippery and you say flooding, we need to figure out what it is we're arguing about. And very often the conversations are simply, is it slippery or is it wiry? And they're often conversations that are being had between 2 students who aren't even positive what the definitions of those 2 words are. And they're simply going, I think it feels slippery. Why? Why do you think it feels slippery? What is it about the pulse quality? You can have intuitions all you want once you've seen a couple thousand patients and once you're out of practice. But when you're learning, let's try to make it specific. What is it about this pulse that makes it feel slippery? And if the answer is, I don't know, it just kind of feels slippery, then that's not repeatable and that's not testable from the practitioner standpoint. That makes sense?
Well, how do you test an FCM3 then? Like if,
Huh?
how do you do tests in FCM3 for pulse?
There's a, like, what are the exams like?
Well, like, are there exams where you're asked to describe what this pulse feels like? And how do you, what's the control that you say, this is the thing, and then do students have to do that?
The pulses in FCM3, from my memory, and this may have changed in the past handful of years, involves a lot of give me the qualities of a slippery pulse, and then there's a lot of case studies. A patient presents with a slippery pulse. What does that mean?
Oh, okay. So just
same with the tongue.
Okay, so just descriptions largely then.
Yeah, you spend a lot of time when the class is in person. You spend a lot of time hands-on with your fellow students, but really most of the practice you're getting for this is in the clinic. So like even as an observer, you can ask to feel the patient's pulse. You know, the intern feels it, and then you dive in, and then there hopefully is an opportunity to chat. Like, so what did you get for the pulse? You shouldn't necessarily assume that the intern is correct all of the time, but they're probably better than whoever is the observer is. But there's a certain degree to which one of the ways to learn, Jason Ginsburg and I disagree about this. He believes learning the pulse is kind of like learning violin, and that if you start learning it wrong, you're in a lot of trouble. And I feel like learning the pulse is a lot more like learning how to paint, where the most important, yes, there's a ton of technique, but let's just talk about hours first. Like Jason would rather you don't feel pulses until you're doing it correctly. I'd rather people feel pulses and then begin to learn what it is they're feeling.
Mm-hmm. It seems like someone, I don't know if it would translate properly, but if someone could do a recording of what each type of pulse would sound like, if you could translate the feel into a sound.
Yeah, I mean, we don't listen to pulses. So I don't really know how I'd go about doing that, but it just takes time. It just takes time and effort. People have made pulse machines that are supposed to replicate certain pulses. I've always found them to feel kind of weird.
Okay.
But it's just a question of time and experience and an acceptance that like everyone doesn't agree on pulses all the time. There are schools that get really specific. The Shen Hammer school has like 5 degrees of gradation of every quality at every pulse position. They take pulses for an hour in their first consult.
Mm-hmm.
They spend 1 hour doing a pulse, and then they're checking up on those individual pulse positions in the future. It's extremely in-depth, but I don't really know why you need that much detail. Like, if you want to be a specialist who does internal medicine based largely off the pulse, that's great, but I see the pulse as useful, and the tongue is useful. They're both really useful, but, you know, talking to the patient is just as useful. And if you're going to spend that much time on the pulse, then there are other things you're not going to do. Yeah. Okay, I got a bunch of questions here in the chat, so let's go through these really quick. So can slippery apply to just one pulse, or is it generally all 3? So you're going to have an overall quality in general most of the time, and then you're going to have sub-quality. So it's like, well, the whole pulse is kind of slippery, but you know what? When I feel into the liver and I press downwards, the pulse contracts and gets much harder. So yeah, everything's kind of slippery. The person's body overall is kind of slippery. They've got a lot of dampness, but when I feel into the liver, there's still a lot of tension there. And so yes, they have liver qi stagnation and a lot of dampness. That's usually how it works. And sometimes it goes the other way. Everything feels really wiry overall. And then as I start to feel into the spleen, oh, I can actually go more superficial in the spleen, and it's a little bit more slippery. Okay. So I've gotten some private messages from one of the students who's been studying pulse with one of their teachers for a while and says they still get the pulse wrong fairly frequently. Yeah, I mean, that's gonna happen. my experience of the pulse, and people will argue with me about this, is that pulse diagnosis is decently objective, but has some subjectivity to it. If I think a pulse is excess pounding and fast, and someone else thinks it's deficient, deep, and slow, then clearly we're feeling two different patients. But if I think a pulse is wiry and another person thinks it's tight, those are decently close. And that might end up just being reflected in the fact that we would treat this patient differently, and we're getting indications of like, well, yeah, I'm more likely to want to move qi in this patient, so I'm going to tend to feel a little bit more of a wiry pulse, and they're going to feel a little bit more of a tight pulse because they're going to work with it differently. There's some variability. I would not expect this to be something where you're all exactly in agreement, even at mastery levels all the time. What I would expect is that everyone's in the same basic area of pulse diagnosis. Things like excess and deficient should not be confused.
Then Peter, would that means that when it comes to tongue diagnosis, like everyone kind of see the same tongue, it's more like agreeable what they're seeing in condition in general?
Yeah, the tongue is definitely easier, but even with the tongue, you know, I've gotten into arguments about whether someone's tongue is red or dark pink. It's like, how different are we talking about? If I think it's pale and the other person thinks it's purple, then we have a problem. But if I think it's a little bit of heat in the tongue and someone thinks it's a medium amount of heat in the tongue, that's not that big of a deal. So you want general agreement. Like, the nice thing about the tongue is, you know, if I think there's scallops on the tongue, I can point to the scallops. I can take a photo of it, I can highlight the scallops on the edge of the tongue. And if another practitioner looks at it and goes, there aren't scallops, then it's like, okay, well then we have different definitions of what scallops are, because this is visible. But when it comes to things like cracks on the tongue, there are things where I'm like, that's a subclinical crack. That doesn't really matter. And someone else is like, that's the most important piece. Like, well, your tradition says this differently than I do. I don't know what to tell you about that. My way seems to work pretty well for me. It seems to work well for the people I've trained. It worked well for the people who taught me. That doesn't mean other ways can't work, but yeah, in general, you want to see basic agreement. In the same way that, like, if you're going to a Western medical practitioner, like 10 different practitioners are going to order different sets of tests for a lot of conditions. But you shouldn't be getting one person sending you for an x-ray for your leg and another person sending you for a lung, like a sputum culture. Like, they should be in the ballpark. Does that make sense?
Yes, thank you.
Yeah. So you want general agreement, but conflict around specifics in the same way that you get in every profession. Every profession. Okay. So, but can you zoom out about the person? Like, someone with that type of pulse may present like, or is that too much? You can definitely do that for some pulses, but I wouldn't worry too much about that now. So there are ways of looking at pulses where they almost get into personality typing through pulses, or like, oh, this is what a slippery pulse type of person looks like. I'm not really into that sort of constitutional typing. That's not really my jam. But some people do that. There's definitely some pulse. Like, you can pick up plum pit chi pretty easily in a pulse. You can pick up there are major life events you can often pick up in pulses. Like, there's a divorce or widow pulse. It's a quality that shows up in between two of the positions that only shows up when someone's like lost someone at that level. There's pulses for grief, but like a lot of these things you can just see on people's faces too. You know, if someone's sad, you shouldn't need a pulse to tell that. Jason Ginsberg tells a story of being in acupuncture school and getting really obsessive about learning pulses. And he spent a year taking female students' pulses all the time. And he got to the point where he could tell within 2 days where someone was in their menstrual cycle from their pulse. And his end of that was like, it made me better at pulses, but at the same time, you can just ask. Like, I don't really know what the point of it. His statement was, I probably should have invested that time differently, because this isn't something I need the pulse to figure out. And this is something that we tend to fall into. It's like, oh, all the information's in the pulse. It's like, or you can ask them. So yeah, pulse is very useful, and it can be a little magical sometimes, but it's not the only tool in our tool chest. And I think talking is probably the best tool that we have to and observe. Okay. We've got just a few more minutes, and then I'm going to give you guys a break so you can do the quiz, and then we'll talk about the final. There's a concern about not being objective enough. Yeah, so what you want to do to the person asking about being more objective is you want to go piece by piece, superficial or deep. How superficial, how deep? Some people use like a 1 to 5 scale. It's like a 1 is completely superficial, and a 5 is all the way down to the bone. So it's like a 2, it's a little more superficial, 3 is right in the middle, 4 is a little bit deep. So you want to have these sorts of things, as opposed to just being like, is this slippery? Let's call this slippery. Because then if you see 10 people as slippery, well, you probably want to know some difference. It's like, this one's slippery, but it was a little more superficial. And your data is all going to be all over the map as you're learning. This is hard, but creating some systems, which you should do next semester, don't worry about doing it on your own. Creating some systems really helps. Yeah, I would just, for now, assume that you're not really going to learn anything clinically relevant about any patients. Also, you shouldn't be making diagnoses anyways at this stage, right? Like gathering information is useful, but the synthesis aspect shouldn't really be happening yet. So just gather data. It's like, oh, that's interesting. I got good at reading pulses because I did it at bars. It turns out people love having their pulses read at bars. Drunk people love having their pulses read. It's fun for them. Same way on facial diagnosis. They'll stick out their tongues. It doesn't matter. So find your version of that. If you've got, you know, a book club you meet with, ask them like, hey, can I check everyone's pulse at the beginning of each one? Like these days, no one touches anybody or interacts with anyone. But when that starts up again, find whatever the mechanism is through which you hang out with people, and do that. Okay. Cool if they could translate the pulse feeling into a sound. Practitioner in Hawaii. Yeah, I mean, YouTube stuff is good. Just don't necessarily take anyone's word for what they're saying. Like the best place to do this sort of, I'm encouraging you to watch other people talk about these things, but really the best place you're going to learn this is in the clinic when you have a supervisor who can come over and say, okay, yeah, kind of, but, and talk it through with you. In the same way that like watching someone teach you how to play guitar on YouTube is useful, but you don't know how much they actually know about it, and you don't know how well it's going to translate into what you want to do. So having the custom experience is most helpful. What's up with practitioners coming up with different diagnoses and treatments for the same patients? I've seen this happen in clinic. What's up with that? So a couple different things. Sometimes that's fine. Sometimes that's not a problem. Sometimes there's legitimate differences in how to approach a patient. Often this is around questions of root and branch treatment or of where to focus. So sometimes patients come in with 4 different things. Like for myself, a patient might come in with the chief complaint of, it's on my head today, polycystic ovarian syndrome, and I might start treating them for insomnia because they can't sleep. And I think that we're not going to be able to make progress on their PCOS until we get them eating, sleeping, and defecating properly. Someone else might see that patient and they might have been trained differently than me and go, the first thing I'm going to do is start trying to get rid of those cysts. Another person might have an integrative medicine background and might be going in saying the first thing I'm going to do is balance their hormones. None of those are necessarily wrong. So what you don't want to see is 2 practitioners seeing the same patient, one going, we need to make them hotter, and the other saying, we need to make them colder. Like that level of opposition is usually wrong. So most of the time when you see differential diagnoses, it's because there's an actual differential diagnosis. There are actually different ways to do it. And that's good. That's a good thing. That's the sign of health within our medicine. It's a problem when those people can't talk to each other, which happens sometimes. Like they don't really speak the same language, but we're getting better at that as a profession. All right, just one more minute. Do you think feng shui is related to TCM? TCM, not so much. Chinese medicine, yeah, it's the exact same idea. Feng shui and older Chinese medicine and Chinese astrology and Chinese systems of government in classical periods, it's all the same philosophical root. So it's all the same underlying ideas. that doesn't mean that you can take feng shui principles and apply them directly. But if you understand Chinese medicine well, and then you go to learn feng shui, it's basically all, I mean, at the end of the day, it's kind of all based on the I Ching. So if you want to learn about kind of the root ideas of Chinese medicine, then you go to the I Ching. And then you go Guangdi Neijing and then I Ching. But yeah, I mean, it's the same ideas. It's the same underlying philosophy. In the same way that astrology and astronomy and surgery come from the same philosophy, ultimately underneath them. Yeah, it's one of the nice things about the Chinese system, the way it was put together, is that if you get good at one field, you should be able to easily get good at other fields. It's pretty nice.
Peter,
Okay, you guys,
one more question, piggyback on that. So what is that the Chinese medicine covers that the TCM does not have?
Okay, we're on a break. You have 10 minutes. At 3:15, there's a quiz on the Moodle. You should go on the Moodle, not back to class. I'll answer your question in just a second, Leon. 3:15 to 3:30, quiz online. Go take the quiz. I expect to see you back here at 3:30. We'll talk about the final exam. Sounds good? Anyone who wants to hang out for the next 10 minutes, I'll chat about questions, but I'm really going to shut this off over here at 3:15 so you can go do the quiz. Okay, pure extra credit quiz. If some of the questions are hard, it's extra credit. So don't worry too much. It's also a preview for the final. Yeah, so Leon, the Book of Changes has a number of ideas in it that are not compatible with CCP in general. Those ideas didn't make it into Chinese medicine, by and large, but were present in older aspects of Chinese medicine. Really basic ideas like the system of government should change semi-regularly because everything changes. That sort of stuff is like, let's maybe not talk about that. So there are aspects of older Chinese thought that just got expunged. It'll be interesting to see if they come back. I mean, it's one of multiple reasons, but it's one of the reasons why simplified Mandarin was made as well. Like, we want the most number of people to be able to read, but we don't want them reading the classics if we can help it. In fact, when we update the classics, let's tweak that a little bit. So a lot of the simplified Mandarin versions of the I Ching are slightly different than the original, for example. Like, if you're reading traditional Mandarin, you can read simplified Mandarin. But if you're reading simplified Mandarin, you can't necessarily read traditional Mandarin. And that was done in part because by the creation of a difference in language, like a lot of the details that are in traditional Mandarin that have secondary and tertiary meanings get stripped out as well. So we take a character that has 20 strokes in it that's really complicated, that has a lot of detail, we change it into a character that has 8 strokes. And then there's not a lot of history to delve into with the character. There's no underlying story that connects to this myth, that connects to this other thing. It just becomes, this character means this. That make sense?
Yes, it does make sense. I'm just curious to know, like, you talk about Chinese medicine, you're always putting in some extra points here and there to supplement the curriculum. So I'm just curious, I mean, why does Pacific College choose to go with TCM rather than a broader CM?
So I don't have a problem with Pacific College being a TCM school. I actually think that that's largely a good thing, but it's largely a good thing because they hire so many of us that aren't TCM practitioners. That they hire so many people who do other things as well. Like, most of the people, who teach at Pacific College have a TCM education, and then also do other things. I think that's a good foundation. So I've had experiences of talking to people who go to 5 element schools, and they only get 5 element. You go to Pacific College, you get TCM and an introduction to 30 other things. So it creates a foundation from which you can grow for the rest of your life in whatever directions you want. So I would say that this is as close as we have to like a Chinese medicine university, where many perspectives are available. And a lot of the schools, if you have a question that's outside of their specialty, they do not have an answer. Yeah, so I don't have a problem with Pacific College being a TCM school. The board exams are TCM. That's the other thing. You know, you go to a 5-element school, your last year of school, you have a class each semester that's board exam prep. You spend a year doing board exam prep. You don't have to do that if you like as a class with exams. You don't have to do that at Pacific College. You can basically study on your own and pass the exams because you've already learned it. So these other schools have to still integrate TCM because you need to know TCM to be able to practice legally. But yeah.
So, I mean, after you finish the TCM curriculum, you actually have to take initiative in supplementing by your interest, perhaps, on, you know, additional Chinese medicine, like philosophies, or, I mean, I don't know. I'm not educated enough to talk about this, but
you don't have to. I mean, you
I
can
know,
graduate from
but
school and do TCM exactly as you were taught, and you'll probably be a fine practitioner. But you have the option of studying for the rest of your life as much as you would like. And through this school, you're given a broad set of ways to go. Like, you leave the school with a roadmap of the majority of Chinese medicine. You may not know it, but you have exposure to a bunch of different ideas. Like, just knowing the names of like Heiner Fruhoff and Lonnie Jarrett and the Shen Hammer School, for me, it's like, cool, you now have 3 different routes that you could go down to become a specialist. Like Hillary thing today, talking about Lyme disease. It's like, hey, if you have an interest in one of these specialties, here's where you go.
right.
You know, most states have required continuing education credits. New York will probably adopt that within the next couple of years as well. So yeah, you're gonna be studying some anyways. Most of the people I know most of the people who are very successful continue to study a lot after graduating.
Yeah.
But it's a lot more fun afterwards because it's weekend classes or an evening a week, and it's from people who are freer in what they're able to share, and that their incentive structure is different. There's no exams. You're there only because you want to learn. The person's there only because they're fascinated about something they become a scholar in.
Right. So in other words, I mean, the difference really is when the CCP started reorganizing, let's say, or institutionalizing Chinese medicine, they applied a lot of ideology to it, and they purged a lot of philosophical aspect of the medicine, right?
That is my understanding of what's happened. This is also something that's happened multiple times in the history of Chinese medicine. Chinese medicine grows and then it contracts. So we just went through a contractile period. A lot of stuff got cut out.
Yeah.
And there are people outside of China who are doing work to revive that. We have a very strong pre-TCM tradition in the US because a lot of those people came to the US. A lot of the people who were doing pre-TCM medicine left China. And a lot of them came here. And that's why we have so many different perspectives. One of the reasons we have so many different perspectives in the US is that a lot of those people couldn't continue to be scholars in China.
Yeah. All right. Well, thank you for spending time
sure.
talking about that.
Absolutely. It's a complicated and a little bit challenging subject, but I think it's important.
Yeah.
Glad you're curious about it. Okay. I'm going to shut down my video here, and I'm going to see you guys at 3:30. Enjoy the quiz. So it looks like there was a question about liver overacting on spleen that people are having a little bit of trouble with here. So the controlling cycle is what it's called when it works correctly, and the overacting is what it's called when it's pathological. So the liver's supposed to control the spleen. It's not supposed to overact on the spleen.
But that's also organ, and that question was stomach, right?
Yeah, sorry, stomach, yes.
But it's the same because it's they're
They're both earth.
right.
So this is a multi-step question, right? I'm saying liver to stomach, and I want you to get to liver earth. Yeah, we can review all the questions. Sure, why not? We're gonna do it a little bit quickly, so we also have time to just talk about the final in general. Let's see here. This may give you more of a window into what creating these is like than I would normally give, but that's okay. Yeah, I don't actually have a document that has all this on it because you have to create this by hand in the Moodle. So let's go through it. Interesting grade distribution. Let's get into this so I can show it. You guys saw that I posted some old quizzes as well. Hopefully those are helpful. Okay. Let's go. All right, it's not letting me into it as normal, so let's go through it. Can I get into this quiz in any way? Sorry, everyone. Normally, I can just go into this and edit it. But now that people have taken it, that's not an option. No, that's not what I want to do. Wow, I'd love to go over this quiz with you, but
Can we read it out loud to you?
that would be
Would that
great.
be okay?
Can you guys still see it?
Yeah,
Okay.
we can see it. Review. Okay, first one. Which organ is full of qi and blood? Choices are stomach, kidney, small intestine, gallbladder.
Well, this is good. So I get quizzed live in front of all of you.
Yay.
All right.
Mm-hmm.
So what's the answer?
Stomach.
Which two there are two organs that are full of qi and blood. One of them is an answer here.
Stomach.
What's the other one?
Oh, kidney.
So Yang Ming is full of qi and blood.
Yang
So that's going to be stomach and large intestine.
no, but large intestine is not one of the answers here.
Yeah,
That's
it's
correct.
not.
But stomach is, and only one of them is a correct answer. So
Okay. All right. Second one. Oh, I'm sorry. That was the second one. The first one is, oh, I'm sorry. Yeah, the first one is the six fulfill their purpose when there is, the answers are protection of the zang, communication with its own, free flow, production of qi.
Free flow.
Everybody? Yeah.
Free flow.
So that's correct. And the idea here is that being hollow organs, they're happy when they're empty. So when you don't have free flow, they fill up. Their job is to continuously pass things through them and have things move freely. So yeah, there's lots of questions showing up here in the chat. I can't get into the quiz at all. There's, before you guys took the quiz, I mean, I can show this even. I make sure I don't show any grades or anything. Moodle's not my favorite thing. There we go. So normally when I come in here, I can go into the extra credit quiz by hitting this, but now it's taken out the part where all the questions are.
What about review option? No.
This is what all of Moodle looks like on the back end.
Oh my God,
It's real rough.
sucks for you.
Yeah, it took me 90 minutes to make this quiz.
I think if you click review options and then click the box that says after the quiz is submitted. Yeah, I think
Which one of those looks
Mark?
like it'll let me in?
I would just do probably overall
Both.
feedback maybe, or the marks. That should be good.
I don't know how to save that. Save and display. So you guys should be able to see this now. But I don't have a, this is going to show you your grades. I don't want to show other people's grades. Yeah, I don't have.
All right, question number 3.
Yeah, thank you.
Okay.
Sorry.
Shall we continue to read?
Yeah.
Please.
Okay, number 3, which organ governs the storage of turbid fluids? Answers are small intestine, urinary bladder, large intestine, kidney.
Urinary
Everybody?
bladder.
Yeah, that's its main job. You guys should be able to get back in and see this now, so that might help.
Okay, question.
That worked, great.
Great.
All right,
Question
next
number
one.
4. Which organ controls decisiveness?
I really hope everyone
Answers:
got that.
stomach, gallbladder, kidney, heart.
Gallbladder.
Yeah. Good.
Question number 5. Which organ governs the separation of the clear from the turbid? Answers: small intestine, gallbladder, urinary bladder, spleen.
Everyone?
Intestine.
Small intestine.
Yeah. Good. If anyone has questions about these, speak up as we're going through them.
Question number 6. Which of the following statements of fact applies to the pericardium? Answers: A,
I don't know.
the pericardium brings wheel into the heart. B, the pericardium governs Wei Qi. C, there aren't any statements of fact about the pericardium. D, the pericardium controls the upper jaw. E, the pericardium opens into the eyes.
Everybody?
Wei Chi, this was hard.
There aren't
C.
You got
any.
this one wrong.
There's no statements of fact.
C.
Oh no!
I put A and C.
So I think I did a pretty good job of coming up with 4 fake statements of fact here.
Yeah.
Yeah, the pericardium didn't have any. We went over that.
That's
and
right. That
why.
was on the first page of the statements of facts.
And it tricked me
Yeah.
up because you put select one or more. So I thought there was more than
Yeah,
one
I got
answer.
that.
I put select 1 or more. All of this should have only
Yeah.
been select 1.
Yeah, you had multiple.
Yeah, you did. I lost
That's
lots
why
of
I'll pick
credits
2
for
answers for that one.
Trick.
Well, all right.
Okay. Number
Well, this
number
probably
8.
means you could have put all of the answers for every single one and gotten
Yeah,
all of them right.
exactly.
Oh, Peter,
And then your answer is that there aren't any statement of fact about the pericardium, right?
Yes,
Yeah.
that is the correct answer.
A.
Okay, question 8.
Yeah,
When
just
is
a moment. Answer is A, right?
I think the
no,
answer is different
C.
for everyone.
C.
I think everyone
The
has
answer is
different
C.
letters.
Oh, it's a different because you know
Different answers. Just to
Yeah.
get the right.
Scrambles it for everyone.
Yeah.
Oh, I'm sorry.
Yeah.
it's a different. Okay, I got it.
Shall we continue?
Question
Yes.
7,
Please.
yes, please.
All right.
Question 7.
Well, I have question 8 here, but here's a question. When this organ doesn't grasp the qi from the lung, it's common to get a cough or even asthma. Which organ is it? A,
Kidney.
pericardium,
Kidney.
B, large intestine, C, kidney, D, stomach. Kidney, right?
Kidney not grasping.
Yeah.
Yep.
Can
Okay.
you read the question
Number
7?
7. I have it. Heart fire is often cleared through the urine. The pathway is heart to what? To urinary bladder. And the channel that goes between the heart and the urinary bladders are, the choices is large intestine, pericardium, small intestine, and kidney. That one I don't know the answer to. So
Small intestine.
Anybody remember this one? We went over this a few
No.
times for the mechanism through which heart causes urinary tract infections.
small.
Small intestine.
Yeah, small intestine.
That's what I thought.
So it's
Oh.
leaving through its paired yin-yang organ. I thought probably kidney was going to be the next
Oh.
most likely thing people would answer because it's paired
Yeah.
with the urinary bladder. But
Yeah.
if you
Yeah.
think
I'd put
through it,
kidney.
either of those could make sense, but we want affinity with the heart to get it out of the heart. And we go heart to small
Heart
intestine
connects.
as yin-yang organs, small intestine, urinary bladder as tai-yang. Yep.
Yeah, that
Right.
question tripped me up because you had more than one answer that you could select. So I was like, is it small intestine or is it kidney? And then I did both and then I got it wrong. But
Yeah. So there was one answer for everything.
Yeah.
Sorry. I definitely intended for that to be how this worked.
Peter,
Tricked
So-
us.
Yeah.
in your question has a little, problem with this one. And then you said the 7 is the answer is kidney, right?
No,
Sorry?
small intestine.
Small intestine.
Oh, okay. And then
Yeah.
question 8 is you said the small intestine, but my answer is no, there are no small intestine.
Channel? Small
Okay,
intestine
questions.
has a channel.
Question
No.
7 is about the heart fire to the urinary bladder. Is that the question you're asking about?
No, question 8, which
Okay.
organ is, you said the answer is kidney?
Kidney. Yes, kidney grasps the chi from the
Yes.
lung.
Okay.
So when a person breathes, if you look back at the kidney slides, you'll see, this might be in the lung slides, you'll see that when we talk about organs connecting to each other, that we discuss the lungs and the kidneys communicating, and that the kidneys have to grasp the chi from the lungs to bring it inwards. And otherwise, if that doesn't happen, what you get is that people who start breathing inwards and like at half of a full breath, they start coughing because the kidneys aren't doing their job of grasping. We treat this, the main herb we use to treat this with is the gecko, actually, which is interesting. Yeah, kidney not grasping is the answer.
Lizard?
That question with heart fire often cleared through the urine. What actually clued me in, and maybe I'm way off, but which channel goes between the heart and urinary bladder? I just thought of the pairing of the heart with the small intestine, and that's even though kidney pairs with UB, I picked. I know is the answer, but is it? Am I oversimplifying? By
Yeah, you got it right. Small intestine was the correct answer.
No, I know, but
Okay.
the way I looked at it was what channel goes between the heart and UB, and I just thought of the 24-hour cycle and the pairing for each.
Oh.
And is that, did I oversimplify that? Am I off base thinking that I got the right answer that way?
If you think like that, you will get the right answer the vast majority of the time.
Okay.
And occasionally it's more complicated, but often it is that simple. Yeah.
Okay.
So good job. Well done. Sorry, I'm getting a lot of private chats here, so give me just 1 second here. Have I sufficiently covered the mechanism of kidney grasping qi? Some people think it's stomach. Stomach does descend, right? So I could see a connection there, like it's the stomach's job to move things downwards, but it doesn't grasp, it just descends and doesn't really have a connection with the lungs. Makes sense now that you say, okay. Missed question 3. Wow, it'd be really nice if I could actually see this. Leon, would you read number 3 again for me, please?
Yes, number 3. Which organ governs the storage of the turbid turbid fluids?
Sure. Right.
And
so,
answer A, small intestine. Answer B, urinary bladder. C, large intestine. D, kidney.
Right. So we've got 2 organs that store turbidity, right? That's the large intestine and the urinary bladder. And only one of them stores fluids. It's a fancy way of saying, where is your urine?
Yeah.
Yeah. Okay.
Okay.
Please keep going.
Number 9, question number 9. The liver excessively and negatively affecting the stomach is an example of the what cycle? A, generating. B, controlling. C, overacting. D, insulting.
Right. So yeah, it looks like this tripped up a number of people. That's good, because it's an extra, we're here to learn, right? So we have the normal generating and controlling cycles. Those are both considered to be physiological cycles. Those are good. We need the controlling to happen. But sometimes we control too much. And when we over control, it's either called the over controlling or the overacting cycle, and it's considered a pathological cycle. We also have the insulting cycle, which is where the controlling cycle goes backwards. And the liver tends to both overact and insult. So we get issues related to the liver showing up not only in the stomach and the spleen, both earth elements, but we also get them in the metal elements, which should be controlling the liver. It's the lungs' job to control the liver. But sometimes instead the liver goes, you can't control me, I'm gonna make this your problem. So yes, if something is happening incorrectly, if something's going wrong, if something's pathological, it's not the generating or controlling cycle, because those are both physiological. So if I talk to you about the liver controlling the stomach, we're talking about the liver doing its job correctly. If I talk about the liver over controlling or overacting on the stomach, then we're talking about it doing its job incorrectly. But I can see why that would trip you up. That makes sense.
So the insulting is really about the son insulting the mother, right? It goes back up, right? Of the parent. And grandparent.
Yeah. So it's the opposite of the controlling. So it's wood,
so the
insulting,
stomach
metal.
Insulting, metal, lung. Okay.
Wait,
and
what's the actual answer?
So what was the answer?
Can you draw that on a diagram
One
for
second.
us?
Let
Peter?
me, Erin, just pause for a second, and we're going to go over this in a little more detail and clear up any confusion here. So, fire, earth. Let's just write all this out. Make sure this isn't confusing. Earth, metal, water, wood. Okay, so here, generating cycle, right? That's just one to the next. Pretty straightforward and easy. Controlling cycle skips one. That's it. So generating, 1 step, controlling, 2 steps. That's all physiological, that's all good. We also have a pathological version. The pathological version is where it's just too much. This is called over-controlling. So we have physiological, and then we also have pathological. And with pathological, we have over-controlling or overacting. Goes by both names. Two steps forward, same as controlling, but too much.
So you're saying over controlling and overacting are the same thing?
They follow the same pathways, but that's like saying a bowel movement and massive diarrhea are the same because they go in the same direction.
Okay,
It's
so
like-
over controlling is lesser than overacting.
Let's just call this overacting for now,
Yeah,
to decrease confusion.
Okay.
Overacting looks the same as controlling, except that we see symptoms, so causes negative symptoms. And then we also have insulting. Did you guys learn this last semester?
Yeah.
Is this new?
No.
You did learn
Yeah,
this.
in
Don't
yeah,
remember
FCM,
much.
it just got
Okay.
got really
FCM1 was my
yeah, FCM1 got fuzzy.
And so insulting.
I'll make sure to mention this a little bit more next semester, a little earlier. Okay, so there you go. That's it. So insulting is 2 steps back. So normally metal should control wood. That's healthy. But wood can insult metal.
Oh yeah.
Just like fire can go back and insult water and can start just draining, the heart can just start draining the kidneys and making the kidneys weak. So those are the 2 things here. So the answer to this question, I was trying to ask, what is it called when wood overacts on earth? What's the name of that? And I offered all 4 of these options, and I wanted you guys to pick this one. I can understand why that was a little bit confusing because it looks like controlling, but that's why I said it's bad as well. So it's overacting, sometimes called over-controlling. I think it should just be called overacting to reduce the confusion, because if some people call it controlling and some people call it over-controlling, then that's confusing. But this is wood overacting on earth. We don't say wood controlling earth. We say wood overacting on earth. We don't say wood over controlling earth either, but as soon as we get into the individual organs, sometimes people do. Does this make sense?
Yeah, so the insulting is really an element insulting the grandparent
Yes.
element.
Exactly.
Okay.
Yes.
All right.
Let me get
It's
a good
not
shot
even
of this
the
here.
reverse of the controlling. It's a grandparent insulting the grandparents. All right, I'm just trying to remember the sequence.
But wouldn't it be the opposite of controlling? Insulting is the reverse.
Yeah, so controlling is supposed to be grandparents. Let me tell a really quick story to make this a little bit easier. I'm going to put that image into the chat. Okay, so in theory, the way that, ain't real old Chinese theory, not saying this is how things are done now, not making any comments on contemporary China. The idea was that it should be the parents' job to nourish the children. It should be the grandparents' job to raise the children. So the parents' job is to give, and the grandparents' job is to control and manage. So when you have a child, we should see the generating cycle coming from the parents and the controlling cycle coming from the grandparents. That's why we call this parents, child, grandparents, grandchildren. But it's pointed out that the grandparents can control too much. If the grandparents control too much, you expect to see problems in the grandchild. It's also pointed out that the grandchildren can tell the grandparents to go screw themselves, which is called insulting the grandparents because that's insulting. So that's where all of this naming and the grandparents and the children and all that comes from. So that's how this is supposed to work. That makes sense?
Yeah.
That actually makes a lot more sense.
Great. I'm going to drop a screenshot into the chat of that diagram. So if you guys want that for reference, it's there. Okay.
Last one,
So
question 10.
yeah, sounds good.
Okay, question 10. From question 9, which of the following symptoms would you expect to see? A, diarrhea, B, cough, C, nausea, D, insomnia.
Okay, so if the liver is overacting on the stomach, what do you think is going to happen?
Diarrhea.
I thought nausea.
Diarrhea
So-
will go to the spleen.
Correct. So when the liver overacts on these organs, you tend to see counterflow. You tend to see the chi move in the direction it normally doesn't move. So the spleen is supposed to move upwards. So when the liver overacts on the spleen, we get diarrhea. The stomach moves downwards. So when the liver overacts on the stomach, we see nausea, vomiting, hiccuping, burping. And when it insults the lungs, we see coughing. So I gave you the options for spleen, stomach, and lung, and then insomnia is just thrown in there. That's not related. You might see insomnia with any of those, but unlikely. Something else would have to be going on. So the answer is nausea,
Nausea.
which you wouldn't get with liver overacting on spleen. You might get gas and bloating and abdominal discomfort, but you're more likely to get diarrhea. And nausea is more the stomach.
I really appreciate the format of your quizzes. I feel like they allow me to think in the way that I hope I'm thinking. You know, I don't know, I can't explain it. They're not like, I don't know, something about the way they're organized makes a lot of sense. So thank you for doing it that way. Sorry, there's a lot of child activity.
No, that's all good. I'm glad that works for you. I'm trying to structure these quizzes. I think multiple choice quizzes are not great overall, but this class is getting you ready for board exams. So it's mandatory in this class because I'm trying to give you some questions that are going to look exactly like this type of question you're going to see on comps and boards. And those are questions like statement of fact related questions. But I also want to have some questions in here that make you take a couple steps of thinking. So I'm glad that you appreciated that, Kyria. But the goal of this is I have zero interest in tricking you. I include some tricky questions because they're on the boards and the comps, like the body hair versus head hair. Like everyone's going to get that wrong every semester. I'm going to say it twice before the exam. I'm going to say it's going to be on the exam, and then people are going to get it wrong. That's just how it works. And then hopefully you don't get it wrong when it matters. But for the other stuff, I'm trying to help you guys think, and getting questions wrong here is a lot better than getting them wrong in the clinic.
So Peter, in the final, we're always going to have one correct answer, right?
Yes, there will only be one correct answer in the final, and I will go back and figure out why that wasn't the case here.
How many questions?
How do you get
How many questions are on the final?
Yes.
I'm shooting for about 75.
Okay.
Just like this. Questions just like this, but nice and long. This extra credit is going to be worth quite a bit. So you guys should be, everyone's passing the class, and now you all just got basically this much more towards 100 points. So this is a substantial extra credit boost. So as long as everyone gets a passing grade on the final, you're fine for this class. If anyone here plans to practice in California, the California board exam is 3 hours long. You don't move, you sit there. It's broken up into multiple sections. Each one is multiple hours long. It's awful. The person next to me had a nervous breakdown while they were taking it. You got to get used to taking long multiple choice exams. So I'm probably going to put in a handful of questions right towards the end of this exam that involve, like, if this doesn't do this, then what else doesn't it do? Just to make you guys deal with being a little bit tired and a little bit fed up with taking a test, and then give you a double negative, because you're going to get those. I'm not trying to be tricky. I'm trying to tell you up front that that's going to happen so that you're used to answering those things. When this was an in-person exam, I had images with fill in the blanks. So like the entire fluid physiology diagram, and you have to fill in every single box for every organ on that. There's no way to do that online that I can figure out. There were short answer questions as well, but it doesn't work to do online. So this is just going to be multiple choice. And my goal is to make you guys better practitioners and get you to pass your board exams. So that's
all
the intent here.
75 questions are going to be multiple choices? There's no fill-ins or truth
I'm
and false?
finalizing this today. When I tried to do matching on the midterm, that resulted in
What's the
2
mess?
questions that took me forever to grade and confused you guys. Like when this is just on paper, you just take all the pieces of paper, you go first page of everybody, second page of everybody, third page of everybody. With this, it takes 45 seconds to get from one person to the next one. And I mean, not that this is any of your problem, but none of that's paid time or anything that I get supported for. So it's a little rough to try to do that sort of grading online.
Yeah.
Sorry, private question. Yeah, I get. I mean, it's an extra credit thing. So these are free points. I hear that issue, but I think we're going to stop here. If you end up being 1 question away from passing the class, then we can revisit that. But I don't think that's a problem because you're doing quite well.
I didn't mean to ask privately. How do you get an organ to stop overacting?
Oh, sure. So usually what that means is that the organ that is doing the overacting is in a state of excess, and the organ that's being overacted on is in a state of deficiency. There's usually why questions about why that's happening in the first place, but step 1 is drain out some of the organ that's overacting and strengthen the organ that's weak. So you might learn this as Korean 4-point. It's like tonify the mother, sedate the child, these sorts of combos. But in shorthand, like if we're talking about the liver overacting on the stomach, like liver 3, stomach 36 gets you 25% of the way there. Just move the liver and strengthen the stomach. That's a start. But there's always something almost always something underneath that you've got to answer as well. Like if the lungs were controlling the liver better, then the liver wouldn't be in excess. So is there a problem there? Are the livers drawing too much energy out of the kidneys? Like how did the liver get excess enough to do this in the first place? Is the person angry all the time? Yeah. No. So that's the longer answer.
Can you clarify a point? You earlier you said the 2 Yangming organs, large intestine and stomach, are full of blood and qi. However, the organs that are supposed to hold the qi, hold the blood, are they're zang organs, right?
Mm-hmm.
So what's the difference here? Is it because they're workhorses?
Yes.
Need to have.
Yeah, that's exactly it. These 2 organs utilize a very large amount of blood and qi to do their job. The stomach, this is part of the reason why after eating a big meal, you get tired. When the stomach has its job to do, the body sends a ton of its resources there to get that done. It's really more the stomach than large intestine, but they are paired as a Yangming pair organ. So when the stomach's busy, it utilizes a lot of your resources. It uses it to make resources, right? So it should be fruitful use of resources. That's about it. The other way it manifests is that when you get stomach problems, the symptoms are usually large because there's a lot of qi and blood. So the Yangming stage of the 6th stage, when the Yangming is sick, the person gets very sick or appears very sick because their symptoms are large because there's a lot of qi and blood to work with. Yes.
So in terms of blood and the zang organs, so we're talking about spleen that makes the blood, and the liver, does that make great? Okay, the liver stores the blood at night. So what does the spleen do?
Is spleen governing blood? You guys remember? This is not stuff that's particularly relevant in my practice. Yeah. So spleen makes blood. We can pull up this slide really quick. These are the sorts of questions that are going to be much more common in your education than in your practice.
Yeah.
Spleen makes blood, and then heart yang moves the blood.
Yep.
Okay, it does
and liver
make
stores
blood.
the blood. Yeah.
Yes.
All right. Thank you.
Yeah. And spleen controls the blood. That sounds right. Then heart governs. And then
Kidney
other
has
organs do
no,
things like control the vessels, and kidney doesn't really interact with blood very much.
okay.
Yeah. Kidney kind of is off doing its own thing. It interacts with most of the other organs, but otherwise it's a little bit removed. Just like heart is. Heart and kidney kind of do their own thing on the side. Both like arguably the most important, or the ones where if you have a problem, that's the most immediately worrisome, but they're also kind of off doing their own thing, because when you have an area that's extremely valuable, you protect it. Yeah. Okay, so this is exactly what the final exam is going to be looking like. About 75% of the exam is going to be these types of questions from the second half of the semester. We're going to be doing a lot of statement of fact questions. We're going to be doing questions about how the organs are connected. And we're going to be doing questions about what the pathology looks like. They're going to stay simple. I want you to know the 5 element stuff. I want you to be able to pick the organ. I'm going to have one question for each organ that's just pulling from the general symptoms section, right? So if the person is, let me pull up a slide just to show you exactly what I'm talking about. Like I said, I'm not trying to trick you guys, but I do want you to really know this stuff. And I'm asking you to know a lot for this final, so I don't want you studying the wrong sorts of things. So if we're looking at heart pathology, for example, I would want you to know for sure, 100%, you need to know these slides for each organ, the general signs and symptoms, right? This look familiar? Each organ has a slide like this.
Yes.
You can basically skip pericardium and Sunjiao for these sorts of things. They're going to get their own questions because they're weird. But for the rest of these, if I say patient presents with palpitation, depression, anxiety, anhedonia, pale or darkened lip color, and sweating, which organ do you expect to see involved? I want you to know the organ. I'm not gonna put pericardium in there. I'm not gonna be tricky in that sort of a way, but you know, it might be heart, lung, kidney, and spleen. Tell me which one it is. And we're gonna have at least one question for each of those. Lots of questions out of the statements of fact. All of this is free game, except for the handful of organs where it says at the top, not being tested, right? Those usually have a page of statements of fact and then a couple pages of statements of fact that say not being tested. And I may pull some questions out from these individual symptoms, but they should be really straightforward if they are. So heart blood deficiency should look like blood deficiency. And then it should also have some symptoms from the general heart pattern. So if you can get heart and you can get blood deficiency, you should be able to get that. And if I do that, I'll make sure that as I do that, I'm going to make sure that that one's not tricky at all. So it's like heart blood deficiency and liver qi stagnation and kidney yang deficiency and small intestine qi deficiency. It's like only one of these even looks close. So those I will be extra not tricky on. Does that make sense? Okay. So Danielle's asking, you only gave us 2 statements of fact for the large intestine. Would an additional statement of fact be that it stores qi and blood? Should be thinking whether the large intestine pairs with the stomach. Therefore, it also stores qi and blood. Well, we didn't get to talking about Xiaoyong Lun. So that question is really coming, I guess, more from Xiaoyong Lun. We talked about that. We talked about the Xiaoyong Lun a little bit in the first half of the semester, but I wouldn't worry about that. The stomach and large intestine being full of qi and blood, there's a whole chart of which organs are full of qi, full of blood, mixed, empty of both. Don't worry about it. I won't ask you about it. Except I just want you to know that the stomach and large intestine are most full of qi and blood. I just want you to know that. So there's lots of things even at this fairly introductory level that it might feel like, wait, we didn't cover that. We didn't cover that. Don't worry about it. You're going to pick up pieces as you keep going. We've well covered what the school wants us to cover for this semester.
Can you just go over that tricky question with the head hair versus the skin hair or the body hair?
Sure.
I think I got it correct, but it seems kind of distant.
Sure. Hair on the head, kidney. Hair on the body, lung. That's it. They really like asking it on boards and comps. You will likely see those questions. So when they say, which organ manifests in the body hair, most people just go, hair, kidney, done. And they go, we got you. But they're just being sneaky and no one cares about body hair anyways. But the answer is lung. Yeah.
Thanks.
Okay. This makes sense to people. Do you feel like you have a feeling of what you're supposed to study? The vast majority of this is just from the slides for each organ that we've covered over the past few weeks. And then there's going to be a smattering of stuff from the first half of the semester, but all the stuff from the first half of the semester is big picture, big concept, stuff you got to know forever. So make sure you know which emotions are connected with which organs. Make sure you know how the chi moves with each of the emotions. Make sure you're comfortable with the directions, the colors, the body tissues. Know that 5-element chart, up, down, and back and forth. That should be in your long-term memory. Yeah, that's the majority of what we're doing.
And lastly, this recording is going to be uploaded to Zoom, right?
Yes, I'm going to be doing that. It should be up today.
Well, thank you.
Should be up today. Yep. Yeah, welcome. Okay. It's been a pleasure working with you guys. I'm going to put my, I just got a practice space myself right by Penn Station. Once I'm sure that I don't have COVID and hopefully my wife doesn't have COVID, or once we're better, I'm going to be treating there. If people have expressed interest to me, both in class and privately, of coming to see me. So I just put my email in the chat. Let me know. It's about 2 blocks from Penn Station. I'd be happy to work with you guys. Yeah, that's just offering it up to anyone who's interested. I hope you're all doing well. I hope you enjoyed the class. It's been fun teaching you guys, though it's a little bit challenging doing this online. The Slack will be up for another couple weeks, and then I'm just gonna get rid of that and start another one next semester. These videos will stay up on YouTube, at least until I complete the next semester. So like there will always be something up for each week. But there will be updates to the slides. And so then as the slides change, what's up online will change as well. Yeah, I just put up a bunch of weeks over the past few days, so you should have access to pretty much everything on the YouTube now. If you have questions, email me, put them on the Slack. That study guide looked great. You know, if you guys want to collaborate, that's kind of what the Slack is for. Post questions publicly, talk about them. And it's been a pleasure working with you guys. I'm going to let you all go. If anyone has questions, hang out. We can chat for a little bit longer. And otherwise, I will see you next week.
Thank you.
Thank you.
Thank you, everyone.
Thank you. Bye.
Bye.
Peter, I do have a quick question. It was a clarifying question from earlier.
Sure. Shoot.
It was about the pulses. I was saying subjective versus objective, not based on like the pulse itself, but based on the person. Like I was doing a lot of the pulses, like my siblings and like my partner, and so I was kind of like not sure about certain things, and I would be like, oh yeah, her is definitely a little bit blood deficient, and like she definitely always, you know, I was like applying what I know about them to their pulse to fill it in, and I feel like is that even a good thing to do, or how do you get away from that?
So in the for now, the goal should be not to diagnose. Like, so, like I used to teach massage, I used to teach body work. And when you're doing that, one of the things that I like to say to people is like, spend a little while just like, especially abdominal massage, spend a little while just feeling what you're pressing on. Like, don't get to like, oh, is this muscle? Is this thing? Like, just spend a little while listening to what's in your fingers. I spent a while doing like practice with acupuncture needles on myself, blindfolded, just to make sure that I'm really feeling this, that I'm finding the point purely through touch, that I'm doing all of the needling just through touch, because you learn things that way. When it comes to the pulse, a lot of times bringing in other information is attempting to make up for the fact that you're not getting information in the pulse yet. And if you get out of getting information by using another technique, then you're not necessarily learning how to use the technique at your disposal. So it is useful to have someone say, like, this is a blood deficient pulse, you should feel this. And then you go and you're like, okay, so I can connect what I'm feeling now with blood deficiency. But it is a little more dangerous and a little more likely to cause longer term confusion if you're feeling someone's pulse and then going, I'm pretty sure they're blood deficient, so I should memorize this as a blood deficient pulse.
Okay.
Because you might be wrong. That make sense?
It does. It does. It's like, but I guess I'm saying, like, you know, I guess for instance, like with your patients, if you have someone that's been coming to you for a couple of years and it's like you're feeling their pulse, how do you be with them new in a new way, as opposed to being like, oh, Peter always has a little bit of like this excess, so it's going to be that, like, where you're, I guess, like, I don't know, I guess I feel like my fingers are doing one thing, but then my mind is doing another, and then I'm trying to figure out how to like marry them. But I think that,
yeah, I mean, I think the only answer I can really give over Zoom is like meditate, like learning to disconnect your head from your experiences a bit. But in practice, I mean, it's easier than you think. Being comfortable not knowing is hard to learn how to do. And it's mandatory for being a good diagnostician. You got to be able to, like, I've had patients where the first treatment, we're like 45 minutes into a discussion, because I know, like, sometimes there's a long opening discussion before we do anything else. I'll get a long ways through, and like in the back of my head, I can hear this, like, oh my God, you have no idea what you're going to do. You don't know what's going on with this patient yet. And then it comes to the point where it's like, okay, let's figure out what to do. And then the pieces just start coming together. But sitting in that place of not knowing creates space to gain information that's unexpected. A big part of the problem is if you're taking the pulse and then you go, I know they're blood deficient, then it's going to shut down the part of your pulse that's actually saying, no, there's heat in the blood. Something will give you a contradictory thing, and you just won't notice that. You can go blind very easily to symptoms if you think you know the answer already. But it takes practice. It takes practice. Yeah, you're welcome. I got a question in the chat. Can you give an example of an insulting cycle? Yeah, I mean, the most obvious place to see this is wood insulting metal, where the liver affects the lungs and the lungs go the wrong direction. But you could have this with people who get really fearful and then they get digestive issues. So someone who gets really fearful and then gets diarrhea, that could be water insulting earth, for example. You get it all the time with people who suppress being happy to be correct, to be proper, which is metal insulting fire. So like joy is supposed to melt the metal. Like joy is supposed to soften the metal aspect. So if it's like, I want to be correct and proper, then even a lot of traditions that are relatively metal have these days or these celebrations where you're supposed to be really joyful. But being too metal and too proper, you get like a very waspy stereotype of someone who's like this is their expression all the time. I'm having a wonderful day and I'm very happy. It's like, well, that's usually an example of like, good, sure, but you should have days where you actually laugh and have joy. And that can be metal overacting on fire. That can be someone whose parents were like, every time they got happy, it's like, no, you need to be focused. Then you get metal insulting fire.
So would you talk about like this cycle as in the generating cycle, or you using the inside cycle? So as
For
in
which?
like either or. So like, you know how you say overacting is 2 steps forward. So is it like wood to fire to earth? So it's technically wood is.
It just cuts straight across. It just cuts straight across. So it's both of the pathological cycles are the internal star, going either too much in the right direction or going in the opposite direction. It's not the outer circle. The outer circle just stays that way. There are things that go wrong with the outer circle, but don't worry about them until much later. If you choose to go down a 5-element route, you can learn about those.
That's why I was confused, because when you say 2 steps forward and you talking about the inner circle, it looks correct because